Our swallowing pathway comprises of 4 phases. It begins with oral phase, followed by oral transit phase, pharyngeal phase, and it ends with esophageal phase. In the oral phase, it begins when lips are opened, in the anticipation of foods or fluids. Then, lips seals around fork or spoon to maintain the food within the oral cavity, to prevent anterior leakage, such as spilling of food. Before that, you have to know that bolus is a term referring to cohesive ball of foods or fluids that is orally processed and swallowed. Meanwhile, tongue accepts bolus in a cupped position. It helps in forming and manipulating bolus before swallowing. Then, the midline of tongue elevates and transfer bolus laterally for mastication between teeth. When the tongue transfers the bolus laterally, the buccinator muscle then transfers the bolus medially in the oral cavity. Together, they maintain the bolus within the dental vault for bolus mastication and manipulation. Other than that, buccinator muscle also helps in clearing the residue in the area between cheek and teeth. Please do not forget that saliva plays an important role in forming a cohesive bolus and transporting the bolus into the pharyngeal cavity. Before swallowing, bolus is contained within the oral cavity through glossopalatal closure or seal. It happens when posterior tongue is elevated and pinched together with soft palate. The closure helps in preventing premature spillage of bolus into the pharynx before actual swallow. During oral transit phase, there is an active drop-push movement of base of tongue that helps in transporting bolus posteriorly into the pharyngeal cavity. It also assists in stimulating the swallowing reflex. Pharyngeal phase starts when the swallowing reflex is triggered and bolus is transferred into the pharynx. Velopharyngeal closure occurs when there is a closure or nasal airway through the elevation of soft palate and the contraction of lateral and posterior pharyngeal wall. Velopharyngeal closure is important because it helps in preventing the bolus from escaping to the nasal cavity or nasal regurgitation. Approximation of base of tongue and posterior pharyngeal wall occurs in the sequence after velopharyngeal closure. It provides initial superior pressure in descending the bolus during transportation.